Pancreas Center is an entity that we've formed within a number of structures, within Columbia University, within New York-Presbyterian Hospital, within the Herbert Irving Cancer Center. Each of them has an important purpose to us. One side is more research, one side is more clinical, and it's our job to bring all of that together for you in one place with one group of people to help you with any needs that a patient or a family might have with regard to pancreatic cancer. So that's really what the center is. Thanks for all of you who are here to support friends and family with pancreatic cancer. Thanks for braving the elements and braving the gas lines and walking through flooded tunnels to get here today. To those of you who simply needed a warm place with light and internet access and you're not really here to learn about pancreatic cancer, you're actually welcome also. I have, through my career, for those of you who don't know me, by the way, John Chabot, I'm a surgeon in what I do day to day. I sort of lead this group of people dedicated to pancreatic cancer, and in doing pancreatic cancer surgery, people often ask me, or point out to me that I have a really difficult job, and that's true. It's hard to take care of people with pancreatic cancer. It's really hard to lose people to pancreatic cancer, and they ask me, how do you do it? And my answer has always been, well, you savor your successes, and you take some satisfaction in helping the battles, even though ultimately sometimes you're going to lose the war. So you really savor those big successes, and you realize that you can help along the way, even when ultimately we're not successful. About a month ago, I read an article that actually crystallized that for me in much better language than I possibly could, and it actually came from the business world. And it's an article that was in the Sunday New York Times business section, and it was really about leadership, and this is an interview with the chief executive officer of a company that invests in the developing world. So they go to places that have nothing, and they try to create some semblance of an economy for the people in really, really developing regions, frontiers. And she described the values of their company. And for me, it resonated instantly. And I'm not going to try to paraphrase her words. I'm going to take her words. The CEO is Jacqueline Novogratz, and their company is Acumen. And what she said is that by pairing values, you create some tension, but it also creates balance in how their employees approach what they're trying to do. They balance listening with leadership. She emphasizes to all of their employees that you have to listen long and hard. You have to really understand the plight of the people that they're trying to help. They have to go to the regions that they're trying to help. But then once they've listened hard, they have to lead. They have to make decisions, and they have to stick with their decisions. And those are two competing values. Accountability and generosity. Obviously, their company intends to do good. The whole mission is to do good in the world. So they have to be generous. But if they simply give away everything that they have to, quote, lost causes, they're not going to last, and they're not going to ultimately do any more good in the world. So they balance accountability with generosity. Humility and audacity. I'm going to talk a little bit more about humility and audacity in a second. And she considers two immutable values that don't need to be balanced in any way, being respect and integrity. And I think those of us in the Pancreas Center display these values on a regular basis, and I'm proud to lead a group that displays these values. More about humility and audacity. Be audacious enough to set goals that make you stretch and give you clarity of vision and purpose. But you have to have the humility to know that this work is hard, that you might not get there. Holding that balance of not being reckless, but also having a huge element of fearlessness. And I think if you contemplate what it takes to be a doctor, dedicated to taking care of people with pancreatic cancer, or contemplate what it takes to be a patient dealing with pancreatic cancer, combining audacity with humility is a really smart way to go. Everybody looks at these things and we all want to run away from them, and I would propose that for all of us, the way we mentally survive is having the audacity to assume that we're going to be on this part of this survival curve. You have to be humble, and especially if you're one of the doctors, you have to be humble to know that a lot of bad stuff happens on the way. But if you don't have the audacity to believe that you're going to be here, then I would propose to you, you never will be. So be audacious. And that's my idea of being audacious. Everything that we do is centered around the patient. We start and end with the patient. We listen. We try to figure out the best way to treat each and every patient, but we also try to learn from every patient and experience, and we try to take that learning to the next patient, whether that's in growing intuition, whether that's in increasing our wisdom, or whether that's in actually making a discovery that then becomes validated to become a part of our medical treatment paradigms. So this is my way of being audacious. We're going to try to learn from every patient. And today, we're going to spend more time listening to patients than to doctors. So with that, I will leave the podium and invite John Paneros to talk briefly about endoscopic ultrasound and ERCP in diagnosis.